like kissing. That's why you bad like this.
I will not talk. Dry skin.
Dry skin. What else? I don't know your patient is dehydrated.
Dry throat.
Dry throat. You should remember the color of your urine because you are the one that did not drink water. She bought 1 liter of water.
Okay, to check the color of urine, if it is yellowish, you don't need dehydrated. Yes.
I'm glad. Oh my God! Last week class gave you guys some motivation. Yeah. This one that refused to drink water, she brought water. Oh. Yeah. You your own water is there. Where's your own water? No water. Oh my God. I'm glad to see this water. This one is the one that amazes me. Wonderful. So we talked about dehydration. Now, if your patient is dehydrated, what do you want to do for them?
You can give them drip.
Do you want to give them drip first of all?
No, first to check.
Check what?
Because
you checked that they are dehydrated. What do you want to do for the patient? You give them water. Somebody that is dehydrated means lack of water. So you want to give them water. It's when it is very serious we give them what? Drink. And we mentioned what are the things that can cause a patient to be dehydrated. What can make a patient to be dehydrated?
To run. To run.
Running. Exercising.
Exercising,
okay.
Yes.
Diarrhea, okay. Vomiting, okay. Coughing. Bleeding. Patient is losing blood.
Yes.
Remember, I told you that your blood is made up of water. Right. If the patient is under the sun during summer, it can also be what? Dehydrated. Are we clear?
Yes.
So now, what is the opposite of dehydration? Edema. And what are the signs of edema? Swelling. What do you want to do for your patient with edema? Give them water in little quantity but regularly. Are we good? Yeah. Okay, so the next one that will summarize enteral nutrition. In level 5 and 6, we will teach you how to feed patients with NG tube. NG tube means nasogastric tube. Today I'm very tired. I'm always tired from class. I think because I use all my energy from 9 o'clock to 3 o'clock, 3:30 teaching. So when you get to class, I'm tired.
You're not good.
Previously, last year, I was here almost every day and I'm living in alcohol. So I will wake up by 5 o'clock to come here because I have class by 8 o'clock. Then I have to rush back to the hospital to clock in because I have to clock in by 11 o'clock. I was running mad, so I couldn't class. I'm not doing. I only come here on Friday. If not, I will die because I'm looking for money. Who eats the money? Me. Family and friends. And they will forget you. That's the worst part. They will forget you. I did not buy my Gucci bag. I did not buy my Louis Vuitton. I did not buy my luxurious car. It was the point. No, I have to live for myself. So I quit. Okay, guys. So, what was I talking about? NG2. NG2. N. Naso. Nasogastric tube. What is naso? What is gastric? Heart. Gas. Gastric. What's the gastric now? Where is the gas?
Is in kitchen.
I give up. I'm done with you guys. Like this final days of this class, I'm done. No, wait, I thought we were more than this number. Yes. What happened? Yeah, all my students. 2, 4, 6, 8. Only 8 of you. We are up to to 10 or if not 15. The other lady that was always coming late, the no guy saw her. Oh, she's good. Hey, the other Muslim lady, right? Yeah, I remember. 2 people I remember. Okay, so gastric is what? Stomach. And gastric is what? Nose. So it means that the tube passes from where? Nose
to
stomach, and then we feed the patient. In your level 5, we teach you how to feed the patient with nasogastric tube. Okay? And that tube we have again for enteral nutrition is what we call PEG tube, known as percutaneous endoscopy gastroscopy. It means, why is it called percutaneous? Cutaneous means skin. So through the skin, they make a cut, fix the tube through an endoscopy. Endoscopy is like a camera, a small camera. They put the camera inside the body and then fix the tube into the stomach. Stomach is gastro. And when we make an opening on the area, we call it stomach. STOMA, the stomach. So that is why it's called percutaneous, through the skin with an endoscopy direct to the stomach. So when we put the tube inside the patient, we feed the patient through this tube. Why are we teaching you this? Because if a patient is on any feeding tube, you cannot give the patient food by mouth. Do we understand? Even water. Patient cannot drink anything, cannot eat anything through the mouth. You only feed them through the tubes. Are we clear? So these are the 2 methods for enteral nutrition. But what do you want to do? In level 5, we'll teach you how we fix it and how we give the patient food through it. When caring for a patient receiving tube feeding, what do you want to observe? Any pain, any nausea, any excessive gas, any redness, and maybe the patient is pulling out the tube. In fact, people with NG tube, they don't like it. It's not comfortable. You find them trying to put it, and they're conscious. Most times we put it because it's for short-term use. What is it? 2 of you can make noise. Why are you sitting down together? So as I said earlier, don't give your patient food or fluid by mouth if they're on NG tube. Remember that only because of the give the patient formula or fluids by tube. Keep the patient's head elevated in low Fowler's position. Remember the low Fowler's position? Yeah. What's low Fowler's position? 30 degrees, very good. At least for 30 minutes after giving the food. Position the patient with gastrostomy tube so that he's not lying on the tube. Find out the nurse how to care for it, which we'll teach in level 5. And also don't get the dressing covering wet. Clear? So today's topic, assisting with elimination. Another long chapter. Oh my God. When it's coming to the end.
Unanisumbua. Hebu ndo ukae huko nyuma na Nabil. Nabil, kama nsiti ya shikambe. Kama nsiti ya shikambe. Shigumba. Enda. You are coming to level 4 and 6? Eh? You are coming to... You are coming to read again? She don't want to come. You are coming to read again? Level... That's 5 and 6. You come back to school? Yes, we will come. You will come? Yeah. Yeah, you should not tell
Yeah. Right? In my computer it's right. Yeah.
But when you get it here for left, you can throw it to inside of you. Okay? In Europe, it's left. You need to try it. I'm not studying again about you will go with this way. I came with 1.5 meters of water. But me, I don't have drink water because of time.
So you want to change?
Okay, well, come here.
She's doing.
You get being so personal. How you want it? It's the one making noise here. Okay, but my class 5 hours. 1 food. 220.
Leo.
Alikuwa amenitext.
Leo.
Alikuwa nimelala yeye.
Twende.
Mimi nilimuuliza hapa.
Unataka ninunue machine zingine? This is not fair. This is not fair. Somebody took my glasses and she don't want to give me. And she took it by force. You forgot it. See, she's telling me to go and buy another one.
Hey, I'm glad to see you.
Last.
I was just asking about you. They said I would not see you and the other lady. Okay, we're just starting now. You're lucky. Only 30 minutes late. Okay. Introduction to elimination. So now, what are the things we eliminate in our body? What do we mean by elimination? Remove. So whatever you eat, you must what? Remove. So how do you remove the things you eat?
You go to poop.
You go to the toilet and you poop, right?
Yes.
And you poop only once in 2 weeks. Because you don't drink water.
This one is personal.
Oh my God.
I cannot be that example.
So, we poop and then we what? Urinate. We also remove excess product through what? Our sweat. Another way through our breathing.
What about the people who don't sweat?
Who cannot sweat?
You don't sweat.
Okay, everybody has a sweat gland. You don't have to sweat physically. But you always find way of what if you go and clean your body, you see that.
Yes.
You don't have to sweat physically like somebody that is exercising. So anyways, our body always remove all these products or excess things that is not needed. Maybe some toxic things that are going to be very harmful to our body. Our body what? We remove it. So how do we get physics? Who remembers the anatomy of digestion? How does digestion happen?
From the mouth to the throat.
What ones? The esophagus,
Tena utuma jana kwa group hata mimi
Stomach.
nimesomea
Then,
in the
what part of the small intestine?
Large.
Before large intestine. Small intestine. Name. What's the name of the small intestine?
Duodenum.
Jejunum. Ileum. Then, which part of the large intestine? Ascending colon, transverse colon, descending colon, rectum, and then anus. What's the color of stool? You have to know the number because you're going to be looking at your patient's poop. You need to know if it's normal or not normal.
It depends with what you eat now.
Normal poop. Yes, the normal color of poop is brown, golden brown. Yes. Yes. That is the normal color of golden brown. See, brown. Either golden brown, a little bit light brown or dark brown, but it is brown. Almost like the color of your skin, but not too much like that. If it is white like this, it means the patient is not producing a particular substance in the body called bile. That's a problem.
What if it is black?
It's black, we now have to find out. Black is not good for us, except the patient eats vegetable, like dark vegetables, take some blood medicine. But if the patient is not on any medicine, did not take any vegetable, did not change their diet, the diet is normal, and the stool is black, the patient is bleeding inside. So it's dangerous. And it's a slow bleeding, you know. Little drops of water, what did they say? Makes a mighty ocean. So when the person was bleeding slowly and dying slowly. So we don't want black stool, except patient took medicine that will make it black, or some vegetable that can make it black. Do we understand? So no black stool. So the normal color of stool is what? Brown. Then golden brown, light brown, a little bit dark brown. What's the color of urine?
White.
Pale yellow or transparent. You know, if you drink lots of that, to be very transparent. Alright. How does urine form? Anatomy? You're forgetting your anatomy. How does urine form? You did not come for anatomy. You guys have forgotten how urine is made. Where is urine made? Which organ makes urine? Hey, at least you remember that one, kidney. How many kidneys do you have?
2.
So the body filters the blood, okay? Because it's blood that goes to the kidney. It filters it from sugar, from bacteria, from blood, from protein. It filters everything into the blood and removes only the clean ones. And that's why you have your urine. That's why you need to continue to what? Drinking water. Because your water is blood. And blood goes to the kidneys. Do we understand? So now we understand the basis of what happens. Most of our patients we want to eliminate. But they cannot do it by themselves. Now, if you want to go to the toilet, do you need anybody to help you?
No.
And do you like anybody to be in the room when you want to go to the toilet?
No.
Why? It is a privacy. But some of our patients cannot, they want privacy, but they cannot. Our patient that is unconscious, can they go for privacy? Our patient that is paralyzed, do they have privacy? But you need to act in a professional manner. So that's why you have to use some words. Like now, if you want your patient, if you want to ask your patient, do you want to go to the toilet? And not just say, do you want to poo-poo? Do you want to wee-wee? You want to use professional what? Language. Do you want to defecate? Do you want to pass a bowel? No, do you want long shots? How do you Kenyans call it? Long shot or short cut? How do you call it? Short cut and long cut, right? Is that what you guys call it in Kenya?
Short cut.
Short cut. Short cut is for urine.
Short call. Them are short call.
Short cut.
Okay, you're not Kenyan, right? You're what, Zimbabwe? Uganda. I keep forgetting. Do you want to ease yourself? Hey, easy yourself is easier. It's better. The Kenyans gave me short cut and long cut.
Short call, not cut.
Oh, call. Like CALL.
Short call.
Short
Like a
call.
call.
Oh, it's short. Oh.
Oh my God. I'm just getting it now. I was thinking, and you want to keep a professional appearance, not because the poop is smelly, but even if you're wearing a face mask, your patient can see you squeeze your face from your forehead. It's going to show you. So you need to keep a professional, even if it's smelly and you feel like dying. Like that.
Support.
You must, and you know some of the patient you have to hold it for them. So you do there and be professional.
Stop breathing.
You stop.
That is not being
Can you
professional.
stop breathing? So how many minutes? Can you hold your breathing like? It's not possible. It's not possible. So, and you cannot hold your nose. And besides, your 2 hands are busy. So you cannot, and you're wearing a face mask. So you're dead. So, okay, you want to use a professional language and you want to give a professional appearance, okay? Why? Because your patient is already uncomfortable. So if you make it with your way of attitude, nobody wants to do it in front of anybody. But because they are helpless, do you understand? So you have to now put it a professional attitude, okay? So use a professional language in communicating with other members of the healthcare team about elimination, and when you're communicating with those in your care. We've already said use professional language. So now, we've already told you the normal color of urine, but in the morning, urine is expected to be dark yellow and smell. Because of what? It's overnight. But during the day, it clears up and the smell will what? Will reduce. And most people always urinate as often as they drink water. Then what about defecating? How often do people defecate? So people defecate or go to toilet twice a day, morning and night. People go once a day. People go once in 2 days. People go once in 3 days. Once in 4 days. You don't go. You're not the tip of constipation.
He's not a human.
You don't eat. What do you eat?
Bread.
Only bread. How can you go to toilet when you eat only bread? You don't eat food. That is why. You need to eat food. What you put is what you will get. You cannot put bread and get something soft. It's not possible. Hard. Do you understand? So, depending on what your patient eats too. Also, as our patient gets older, it's not easy to go to toilet every day. So, if you have an older patient, you might go to toilet once in 2 days or once in 3 days. They are mostly what? Constipated. So, if your patient is constipated, what do you want them to do? Drink water. Move. Exercise. When you exercise, you'll be able to move your intestine. Do we understand? Eat fruits. There's a fruit that helps with toilet. Papaya. Papayas. Yeah. I thought we were making papaya is good. Kiwi.
And dragon fruit.
Oh, dragon fruit. Is that dragon fruit nice?
Yeah. But it's good.
I've never tried it.
Tasteless.
Tasteless.
It depends.
It depends.
The white one and the pink one. They just
So which is better?
the pink one. The pink one.
Dragon fruit. Dragon fruit is the one that has the song.
Maybe when you
But is it different? Dragon fruit and passion fruit, are they the same?
no.
They're two different fruits.
Yeah.
Okay.
But the watermelon it's good for the
Yes, constipation too, because it has lots of water. Yes. Oranges too. So you want to encourage the patients to eat fruits, vegetables, drink water, move around to avoid what? Constipation. Okay. So in helping your patient with a urination pattern, you want to ask your patient, how often do you urinate? Is there anything special about your urination habits? How often do you have a bowel movement? What time of the day do you usually have a bowel movement? Like men. You know when men go into the bathroom, they forget that there is a word existing. They stay there 5 hours with their phone. They sit down there. Women, we don't have time. We're thinking of the next meal to cook. Is there anything special about bowel movement? So also ask your patients. So now, how do we promote patients' normal urination? You want to maintain their normal pattern. Don't change it. If a patient always goes to the toilet in the morning, don't come and bring the bowl in the evening. Go in the morning because patient is used to going to toilet in the morning. And sometimes patients can always ring the bell. Don't delay in answering the call, yes, so that you can help your patient. So as we mentioned earlier, if your patient is constipated, you want to encourage them to drink more water. More water will make the stool to be what? Soft. Also, when you drink more water, the urine will be clear and transparent. We've also said that patients should exercise. Exercise will help to move the intestine. If the intestine moves, the food will flow down and the patient can be able to defecate. They should take food high in fibers like fruits, vegetables, and whole grains. Of course, we want to provide privacy to some patients that can go to the bathroom by themselves. And then, of course, we want to promote comfort. So we mentioned assistance like this. Okay. So now, we have some patients that they can walk by themselves, right? They can move. They just need some assistance. So if they can move by themselves, there's no need to use any assistance. What do you need to do? Take them to the bathroom. Ensure that the call button is in the bathroom. What do you do now? Close the door and stand by the door. And every 5 minutes, you knock. Mr. A, is everything okay? You sure you hear a response? Do we understand? You're giving the patient what? Their privacy, but you're not far away. This is for a patient that can move and they can walk to their bathroom. Are we clear? When the patient is done, they might need you to help wipe their butts. And we did perineal care, right? We did perineal care last week, right? So we know how to do perineal care.
Yes.
So you provide perineal care for your patient. And don't forget to tell your patient to wash their hands. That is for a patient that can go to the bathroom early. Then what if the patient cannot go to the bathroom by themselves? The patient can walk, but they cannot walk long distance. Maybe they have arthritis, joint pain. So what do we use for them? We use what we call a portable commode. Can we all say it together? Portable commode. So this is like this. So it's like a potty, but a potty like in a chair. Do you understand? This is for patients that can move, but they cannot move far distance. So this is by the patient's bedside. You can see the bed. So the patient just gets down from their bed, poops, urinates. What do you now do? Remove this one and dispose in the bathroom. Is it clear? So this is for patients that can move, but they cannot move for long distance. Then, if it's a patient that cannot move from the bed at all, you will now use your bed pan. So this is called a bed pan. The bed pan is used for women to urinate and defecate. Do we understand? Women to what? Urinate and defecate. For men, we use the urinal for urination and this one for defecation. Are we clear?
Yes.
Women will use this one for what?
Defecation.
Urination and defecation. And men?
Defecation. Urination.
You know this one is easy for urination. Why? The man's penis can fit into here.
Man will put his penis or you will put.
So now, if you have your patient, let us say this is our patient, this is our patient here. So let's say this is our patient's penis.
Yes.
Okay, and the trouser. So your patient is on bed. This is for a patient that cannot move. Remember we talked about patients that can move to the bathroom. They go to the bathroom. The only thing you do, stand by the door and check her regular every 5 minutes to check that the patient is still available. Do we understand? The patient that can move, they cannot move for long distance. What do you use for them? Portable commode. Right? Now, this patient cannot move, paralyzed, have difficulty walking, is on the bed, and they need to use the urinal or urinate, and he's a man. Maybe he has a stroke. You're going to help him unzip his trouser, bring out his penis, and fix it inside here, and he pees.
So I'm gonna do that.
Your ancestor will do it.
This job is hard though.
Who makes it hard? You know what they're paying them in the US and in the UK? That's good money.
Yeah, only this guy, but this one, this